So I mentioned that there's 3 common vaginal infections on that first slide. So I definitely recommend that before you even get into trying to study this content specifically, have a good understanding of this chart. Because again, it's unlikely that a patient will just come to you and say, I think I have trichomoniasis, but rather they're going to say, I've noticed X, Y, and Z symptoms. And it's going to be up to you to be able to identify, oh, that might be trichomoniasis or something else, and be able to guide your patients. So if you have a good understanding of the chart, it'll help you with case questions on quiz and on the exam. And I mean, just practically like for real life, like pharmacy practice, right? So if we start all the way to the left, before we talk about an infection, under normal conditions, normal circumstances, we do have vaginal discharge. That is normal. It is a cleansing type of mechanism. It's typically clear, it might be white, but it is odorless. And it serves to clean. It is not irritating. It usually does not cause any associated symptoms, like no local redness, no itching, no irritation, no burning, nothing like that. So any sort of change to that could be a sign then of a vaginal infection. And remember, it's typically acidic because that is a defense mechanism. In cases of vulvovaginal candidiasis, that is a vaginal yeast infection, which we'll talk more about here shortly. There's no change to the vaginal pH. Patients can test for that, so there wouldn't be a change. But there is a change to the vaginal discharge itself, in that it's thick, it's white. It's often described in practice as cottage cheese appearing, but it's odorless. That is a huge key difference from bacterial vaginosis and trichomoniasis. No odor that's associated with it. And it can cause some associated localized symptoms like itching, burness, redness. What you'll note at the bottom, it's a fungal infection, all right? So over-the-counter products are antifungals. Bacterial vaginosis, trichomoniasis are different. If a patient tests for vaginal pH, it's going to be higher. We'll talk about testing here in a moment. In cases of bacterial vaginosis, there's also a change to the discharge itself. It can be thin, it can be watery, it'll be discolored, but the big key symptom is a characteristic fishy odor that is associated with it. Associated localized symptoms, vaginal itching, irritation are not common. It's really the foul-smelling, fishy odor that a patient might report. That is a sign of, oh, that might be a bacterial infection and you need to be referred. So the name implies it, bacterial vaginosis, bacterial infection. Antifungals will not target a bacterial infection. Trichomoniasis, all the way there on the right, patients might have a yellow-green vaginal discharge. It might look frothy. It's also foul-smelling, but patients will also have the associated vaginal symptoms like redness, irritation. This is a sexually transmitted infection. It's caused by a parasite. As you could probably imagine, again, no over-the-counter products. Antifungals will not target bacteria. They will not target a parasitic infection. So that is why we really need to differentiate what the patient's presenting with, because if they have bacterial vaginosis or trich and you recommend like monostat or an antifungal, it's not going to do anything for that infection. It's going to go untreated. It could lead to complications like pelvic inflammatory disease.